Hi, my name is Kirsty and I'm an orthopaedic physiotherapist at the MATA Private Network in Cork. We hope this video will educate and prepare you ahead of your upcoming surgery with us. This video reviews the information described in the booklet that you may have already received. We will guide and support you through your recovery until we feel it is safe to discharge you from our care. On your arrival, you will be greeted at the main reception desk in Building A. From here, you will be called into a private office by the admissions team to verify your details, sign your general hospital consent, and you will be issued with your wristband, which contains your name, address, date of birth, and your hospital number. Once this process is complete, you will be brought to your room where you will meet the nursing team, who will prepare you before your surgery. Once your surgery is complete, you will be transferred into our recovery room until your observations, such as blood pressure, heart rate, and temperature, are normal. When the recovery team is satisfied, you will be transferred to your room until you are discharged from the hospital. As part of our enhanced recovery program, we endeavour to see you on the day of surgery. In order to avail of this, you will need to be back on the ward and have good strength and sensation in the operated leg. This session is to educate you about the exercises that will aid your recovery. Depending on your condition, we may also attempt your first steps in the room using a frame or crutches. If the physiotherapy team does not get to you on the day of surgery, do not worry. We will visit you early the following morning.
After this session, your participation in the recovery process is fundamental, and you will be a very active partner in this journey. You will have an exercise information sheet to refer to. The physiotherapy team will continue to assist you at walking until it is safe to continue this on your own. We will advise you about how much you should be walking once you are at home. If you have stairs or steps at home, we will instruct you on how to navigate these safely. We will work to ensure that you can get in and out of bed independently before you go home. This may not always be possible, and progress on this will depend on your pain levels and on swelling. Hip replacement patients face a risk of hip dislocation. To prevent this, avoid bending down to the floor or moving your knee higher than your hip for 6 to 12 weeks after your surgery. Avoid crossing your legs while lying down, sitting or standing. Avoid swiveling or twisting on the leg which has been operated on. A long shoehorn and a grabber to help you pick objects up from the floor are helpful tools to avoid these situations. Some people may wish to purchase a raised toilet seat, but we can advise you on this during your stay. Once you achieve all of your physiotherapy goals, you will be discharged from physiotherapy. This usually happens 2 to 3 days after surgery. It is important to be mindful about what to bring with you to the hospital. I would advise you to pack slippers or low, flat shoes that have a closed back on them. Backless shoes do not give you stability and can increase your risk of a trip or a fall. Do not bring shoes that are tight-fitting. You will have some swelling post-surgery and it may be difficult to put tight shoes on. Having access to a long-handled shoehorn for putting on and removing shoes will help most patients, especially hip replacement patients. We also recommend that patients try to dress in their normal clothes each day. It is easiest to dress in loose, comfortable clothing such as tracksuits, shorts, or a long night dress. The clothes you pack should also be suitable for the exercise you will take part in during your recovery. It is normal to experience swelling after the operation. Swelling usually happens over the 1st to 2nd days and will persist until you are back walking normally. Ice may be applied to the leg which has been operated on, and your leg will be elevated intermittently throughout the day. You should continue this practice at home until your review at 6 weeks post-surgery.
In advance of surgery, preparing your home is key. Remove any obstacles that may be a trip or fall hazard. If you live alone or feel you can't manage your recovery on your own, you may need to consider a period of convalescence. If you are considering convalescence, it is your responsibility to arrange it and inform us of your arrangements. Depending on your surgeon's protocol, you may be advised to complete a follow-up physiotherapy appointment. For knee replacement patients, this appointment is advised for 14 days post-surgery. For hip replacement patients, this appointment is advised for approximately 3 weeks post-surgery. You have 3 options for these appointments. You can attend our hospital for a one-to-one session. You may consider our orthopaedic rehab class. These classes are run in the outpatient physiotherapy department. The class takes place once a week and each session lasts for 1 hour. It is a circuit-based exercise class where you will learn to exercise safely and effectively to increase your movement and strength. Or you can organise an appointment with your local physiotherapist you already know. We can discuss these options further during your stay in the hospital. I hope you have found the information in this video helpful. Please remember to read the joint replacement booklet before your surgery. The physio team look forward to welcoming you to the Matter Private Network and to be part of your journey as you recover.